Today's date is July 31st, 2014. This is a video of Dr. Joshua. We'll leave his last name out for a moment, but leave it to say he is a traditionally trained medical doctor, and he's an ENT physician. He's an ENT surgeon. He came out to spend a day with me, sort of as an apprentice this day, and he's agreed to let me video what he saw and experienced today.
Yeah, firsthand. I would just say I look forward to a day when traditional medicine accepts this as part of what we consider mainstream. These are no tools that I learned during my training, but I hope to be able to incorporate into my practice.
And you saw some things today with regards to teeth, and you're an ENT surgeon.
Yes, I certainly have never recommended a dental examination for a head and neck pathology, but I saw instant improvements in patient today after treatment.
Was it the type of improvement that you could believe, or you would have?
Almost unbelievable, almost completely unbelievable.
Earlier today, I think you used the word speechless.
I was speechless. Yeah, absolutely.
In terms of one of the patients you saw, he came in. This is interesting because you're an ENT doctor. He came in with ear problems, right? And you presumed it was a eustachian tube dysfunction, and he also has known repeated sinus infections, correct?
That's correct.
And I think I did something you would have never thought of or seen before, correct?
Absolutely.
And it was directly in your field.
Completely.
I evaluated him and found a disturbance in where he had his tonsils taken out as a child, correct?
Yes. Beware all those parents. I was utterly amazed that the scar tissue from his tonsil could have any impact on his constant sensation. Although the nervous system, we do talk about referred otalgia, and so it's not so far-reaching, but certainly nothing we've ever, in traditional medicine or traditional ENT, ever discussed.
He experienced, when I injected his tonsillar scar, he got an instant release in his ear, correct?
Instant.
And you also saw me do his foot, the base of the Achilles tendon, where it inserts on the calcaneus. And while it took a little while for the injection itself to pass, about 3 hours later, what did he tell you?
He truly walked out a new man. He felt more balanced. His head was clear and his gait and foot was steady. He was very happy.
And you also witnessed a woman that I videoed. That must have come as a shock to you as well, you saw the range of motion of her neck.
Yes.
Right? And it was restricted. Both rotation and flexion extension was restricted. And what happened to you, or what did you think when you saw after we injected socket number 2?
I need to rethink my physical examination skills. I certainly didn't expect her to completely loosen up her neck and improve across the board.
But you saw an instant.
I saw it instantly happen.
And it was dramatic.
Dramatic.
Yes? Okay. I may post this on YouTube?
You may.
Any other comments about your one-day experience here?
If you have an open mind and you want to know the truth, you will find it.
Is it, out of curiosity, is it something you would recommend to other physicians?
I would.
Okay, thanks. You can always say no. Dr. Josh, we were just discussing before today how you would have looked at that man who came in with the repeated sinus infections and ear disturbance, if he would have come to you as a standard ENT doc.
Sure, certainly. For the ear, with the history of sinus infections, I certainly would have been very suspicious of eustachian tube dysfunction as it relates to his nose, which already suggested some nasal disease. I probably would have treated him for a while with allergies to see, treat allergy treatments to see if that improved. Nasal steroids, topical nasal treatment with saline and et cetera, to see if we could improve some of that sensation and whatnot. I would have evaluated his TMJ to see if there's any dysfunction there. A lot of ear discomfort can masquerade in my field, or at least I see a lot of patients who have misguided TMJ.
And now the rage is GE, gastroesophageal reflux,
Absolutely.
causing problems, right? That's the current rage. Now, even if he did have the dysfunction you were talking about, and steroids, you felt steroids were indicated, think about it for a moment. Does that fix the underlying problem?
No. Well, you have to know what the problem is before you can start a treatment.
From my perspective, as the integrative doc, all steroids do is cover up a problem. They suppress symptoms instead of getting to the cause.
Yeah, we still have no definitive treatment for eustachian tube dysfunction.
Right, and in my experience, it could be a disturbance in the autonomic nervous system, just as we saw today.
Yeah, it's quite unique and quite interesting.
Yeah.
A very valuable lesson, diagnostic lesson.
And as an ENT doctor, you've taken out tonsils.
Certainly, yeah.
And I'm not knocking that at all. I had my tonsils taken out, and I think appropriately, it's appropriate. All surgeries are good when they're
clear indications.
When they're indications. The problem is they leave scars, and that can disturb the nervous system, and we need to pay attention to that. Thanks.